1. Maharashtra Suspends Homeopathy Practitioner Registration. 2. Medical Disaster, Homeopaths Prescribing Allopathy. AMC vs. MMC. 3. Homeopaths vs. MMC, Registration Row explained Maharashtra Medical Council update. 4. Maharashtra government stays order allowing homeopathy doctors to prescribe modern medicine. 5. Doctors protest against Homeopath-Allopath controversy in Maharashtra. 1. Maharashtra suspends homeopathy practitioner registration. In a significant move, the Maharashtra government has decided to halt the registration of homeopathy practitioners who have completed a bridge course in modern pharmacology. This decision comes in response to concerns raised by the medical community, particularly the Indian Medical Association, IMA, which had previously filed a writ in the Bombay High Court earlier this year regarding the registration of homeopathic doctors with the Maharashtra Medical Council, MMC. On Friday, the state established a committee to address the apprehensions expressed by doctors about a recent notification that permitted homeopathy practitioners to register with the MMC after finishing the certificate course in modern pharmacology, CCMP. Following the state's commitment to suspend the registration process and the issuance of a government circular to that effect, the IMA decided to call off their planned protests. Dr. Santosh Kadam, the president of IMA Maharashtra, articulated their concern to the Indian Express, stating that allowing homeopathy practitioners to register with the MMC after completing the CCMP could enable them to practice modern medicine, which raises serious questions about patient safety and the integrity of medical practice. Numerous organizations, including the Maharashtra Senior Resident Doctors Association, have voiced their opposition to the government's notification dated June 30, 2025, which allowed homeopathy practitioners who completed the bridge course to register with the MMC starting July 15. These groups supported the IMA's call for a token strike, emphasizing the need for rigorous standards in medical practice. The IMA's legal action in the Bombay High Court earlier this year was a direct challenge to the potential registration of homeopathic doctors with the MMC, reflecting the deep-seated concerns within the medical community. Doctors have raised critical questions about whether a bridge course in modern pharmacology adequately prepares homeopathy practitioners to safely prescribe allopathic medications. In a meeting with Chief Minister Devendra Fadnavis, Dr. Kadam, along with former MMC Chairman Dr. Shivkumar Atare and other medical professionals, discussed these pressing issues. The Chief Minister directed the Principal Secretary of Medical Education, Dheeraj Kumar, and MMC Administrator Dr. Vinky Ruwani to engage in discussions about the matter. Consequently, a committee was formed, chaired by the Commissioner of Medical Education, which includes representatives from the Maharashtra University of Health Sciences, the Maharashtra Homeopathy Council, and the MMC. Dr. Ruwani informed the Indian Express that the committee has been tasked with submitting a report within 2 months. Until the report is submitted, the government has agreed to retract the notification, he added. As per the MMC circular, the registration of homeopathy practitioners who have completed the CCMP is now on hold. In a conversation with the Indian Express, Dr. R. S. Indulkar, an advisor to the Maharashtra Homeopathy Council, explained the rationale behind introducing the bridge course. He pointed out the pressing need for medical professionals in remote areas of the state, where there is a shortage of doctors, as many prefer to work in urban environments. By completing the CCMP, homeopathy practitioners can enhance their skills and gain the ability to prescribe allopathic medications. Dr. Indulkar raised an important question: if many hospitals in urban areas employ homeopathy doctors, why is there such a disparity in recognition? In a show of protest, Dr. Bahubali Shah, an administrator at the Maharashtra Homeopathy Council, has announced his intention to undertake a hunger strike. Anuradha Mascarenhas, a seasoned journalist with the Indian Express based in Pune, covers health, scientific research and women's issues. With over 25 years of experience, she has led editorial teams and coordinated various editions. 2. Medical Disaster, Homeopaths Prescribing Allopathy. AMC vs. MMC. Imagine a scenario where standard medical practice is being questioned and even threatened. What if non-physicians begin prescribing powerful medications without proper training? This unsettling possibility is at the heart of a recent controversy, that has sparked widespread concern among healthcare professionals. And here's where it gets controversial. A decision by the Maharashtra Medical Council, MMC, to allow homeopaths, after just a short course, to practice allopathic medicine has ignited fierce debate about patient safety, ethics, and the very integrity of medical regulation. The Association of Medical Consultants, AMC, from Mumbai has vocally condemned this move, describing it as unsafe, unethical, and legally dubious. They warn that this decision could lead to dangerous medical errors and legal complications, raising critical questions about who should be allowed to prescribe life-saving treatments. Recently, the MMC approved a scheme permitting qualified homeopaths, who complete a brief 6-month certificate course in Modern Pharmacology, CCMP, to register under their authority and prescribe allopathic medicines, medications typically reserved for fully qualified MBBS doctors. This move has alarmed many in the medical community. Experts argue that equating such a short, part-time course with the rigorous training of an MBBS degree, taking over 5 years, and including clinical rotations and emergency care, poses a significant risk to public health. Dr. Rajiv B. Agarwal, president of AMC Mumbai, expressed deep concern, stating, "This isn't just a bureaucratic mistake, it's a looming medical disaster." Comparing a weekend course to a comprehensive medical degree is dangerous because it compromises patient safety, erodes trust in healthcare, and damages the credibility of the entire medical profession. The AMC highlights several fundamental reasons for their vigorous opposition. Contradiction of regulatory mandates *. The MMC was originally established to oversee only practitioners of allopathic medicine. Extending its scope to include homeopaths contradicts their legal jurisdiction. Overlap with separate systems *. Homeopathy is overseen by the Maharashtra Council of Homeopathy. Allowing homeopaths to prescribe allopathics blurs clear boundaries, which can cause confusion and undermine the integrity of both systems. Insufficient training *. The CCMP course is conducted over just 6 months, with classes held once weekly for a few hours. This minimal training is widely regarded as inadequate when compared to the extensive education and practical experience gained during an MBBS program, such as clinical rotations, emergency procedures, and ethical training. Public health concerns *. Allowing individuals with limited training to prescribe powerful medicines increases the risk of misdiagnosis, medication errors, adverse reactions, and ultimately jeopardizes patient safety. Dr. Prashant Kirkar, the honorary secretary of AMC Mumbai, warns, this decision essentially legalizes quackery. When untrained individuals cause medical mishaps, responsible parties, like the state, must be accountable. It's imperative that authorities step in to prevent such violations. Legal complications further complicate the issue. Since 2014, the Bombay High Court has been reviewing the legality of this kind of crossover. In their order from Writ Petition No. 7847 of 2014, the court emphasized that admissions to the CCMP course remain subject to future court rulings, highlighting ongoing legal uncertainty. This move could even be considered contempt of court, explained Dr. Mukesh Gupta, chairperson of AMC's Media and Communication Cell. Furthermore, the Central Council of Homeopathy objected to similar crossover practices back in 2014. No progressive healthcare system endorses this kind of mixing of practices. Another common argument is that the healthcare system faces a shortage of MBBS doctors in rural areas. However, AMC experts argue this is a misconception rooted in administrative failings rather than actual shortages. For instance, thousands of MBBS graduates are awaiting their mandatory rural service postings. Maharashtra reportedly needs around 4,000 doctors for its primary health centers. Yet, numerous vacancies remain unfilled, not due to a lack of doctors, but because of systemic issues like poor planning and deployment strategies. We actually have enough qualified doctors ready to serve in rural regions, said Dr. Agarwal. The real problem lies in inefficient administration, not in the number of available healthcare providers. Instead of diluting standards, the government should improve systems for deploying these doctors effectively. In response, the AMC has laid out clear demands. 1. Immediate revocation of the MMC notification permitting CCMP qualified homeopaths to register as allopathic practitioners. 2. An unambiguous declaration that the MMC remains the sole authority for licensing allopathic doctors. 3. Ensuring public safety by upholding strict ethical and legal standards in medical training and practice. The AMC warns that failure to fulfill these requests could lead to protests, legal actions, and civil disobedience, including demonstrations and sit-ins. "We're not opposing homeopathy here," clarified Dr. Gupta. "We respect its place within its own framework. But allowing non-qualified individuals to cross into allopathic practice is dangerous. It blurs essential boundaries and risks lives. The government must take responsible action." With increasing concerns from both the medical fraternity and the public, the focus is squarely on the MMC and the Maharashtra government to clarify and rectify this contentious decision. The broader question remains, should healthcare standards be compromised in the name of short-term solutions? Or is this a dangerous step backward for medical regulation? What do you think? Share your opinions in the comments and join this vital debate. 3. Homeopaths versus MMC, Registration Row explained Maharashtra Medical Council update. Imagine a world where homeopathic practitioners are denied the right to prescribe allopathic medicines, despite having the necessary qualifications and training. This is the reality that homeopaths in Maharashtra are facing, and it's a topic that's sparking intense debate. But here's where it gets interesting. The Maharashtra Medical Council, MMC, registration for homeopaths has legal backing, and they're waiting for the state panel report to confirm their rights. With over 90,000 homeopathic practitioners in the state, only 9,160 have completed the CCMP course, which is a bridge course designed by the Maharashtra University of Health Sciences, MUHS, to equip homeopaths with the skills to prescribe allopathic medicines. Dr. Subhash Raut, President of the Homeopathic Integrated Medical Practitioners Association Maharashtra, HIMPAM, Nagpur branch, emphasizes that they deserve registration under the MMC to get the just right to prescribe allopathic medicines. The CCMP course is not just a theoretical exercise, it's a comprehensive program that was taught by qualified government teachers in government medical colleges. Dr. Anand Gadewar, Secretary of HIMPAM, Nagpur, points out that the course clearly specifies which procedures homeopathic practitioners can perform, and which are strictly reserved for MBBS doctors. They have no intention of intruding into the rights of modern medicine practitioners, and respect the government's decision to form a committee to examine the matter. The committee, which will be chaired by the Commissioner of Medical Education and Research, MERC, will include representatives from various stakeholders, including the Pro-Vice Chancellor of MUHS, the directors of DMER and Ayush, and the administrators of MMC. Homeopaths are optimistic that the committee's findings will recognize their qualifications and grant them appropriate rights under MMC registration. But here's the question: if resident medical officers, RMOs, being homeopaths is fine, then why deny them MMC registration? Dr. Kushal Narnaware raises a valid point when he says that Nagpur has 530 modern medicine hospitals, and 90% of RMOs there are homeopathic or Ayush doctors. The timeline of events is also worth noting. The MMC issued a notification allowing homeopaths with a CCMP to apply for registration on June 30, 2025, which was followed by protests from the Indian Medical Association, IMA, and resident doctors, MARD. The government eventually announced the formation of a committee to study the matter, and the MMC withdrew the notification. The planned IMA strike was called off, but the debate is far from over. And this is the part that most people miss. The issue is not just about homeopaths versus modern medicine practitioners, it's about recognizing the value of integrated medicine and providing patients with more options. So we ask you, do you think homeopaths should be allowed to prescribe allopathic medicines? Should they be granted MMC registration? Share your thoughts in the comments below. The controversy surrounding this issue is undeniable, and it's time to spark a conversation. But what do you think is the way forward? Should the government recognize the qualifications of homeopaths and grant them MMC registration, or do you think it's a threat to modern medicine? The debate is ongoing, and we want to hear from you. 4. Maharashtra government stays order allowing homeopathy doctors to prescribe modern medicine. In a dramatic reversal, Maharashtra's recent decision to expand medical practice rights has hit a roadblock, but here's the kicker: this controversy exposes a bitter divide between traditional and modern medicine that could reshape healthcare access in India. The state government has temporarily blocked a policy allowing homeopathy practitioners to prescribe allopathic medications, following intense pressure from mainstream medical associations. While the initial proposal aimed to address rural healthcare shortages, the Indian Medical Association, IMA, argued this put patients at risk, a claim even the Chief Minister now partially acknowledges. The turning point came on July 10, 2025, when IMA leaders met CM Devendra Fadnavis. Within 24 hours, a government notification halted registration of homeopathy doctors trained in modern pharmacology, via the CCMP program, until a special committee investigates. Here's why this matters: homeopathy focuses on holistic treatments, while allopathy uses targeted medications. Critics like the IMA claim blending these approaches without rigorous training creates dangerous blind spots. This isn't about turf protection, it's about patient lives, declared IMA State President Santosh Kadam, referencing court rulings that seem to validate their concerns. Protest versus pragmatism: doctors planned a statewide strike for July 11 but called it off after government assurances. However, tensions persisted. At Nair Hospital, resident doctors silently protested by wearing black ribbons during shifts, an unusual sight in busy wards and operating theaters. The temporary committee will have 2 months to weigh these competing interests. Proponents argue expanding prescribing rights could improve rural access, while opponents warn it risks medical errors. If homeopaths handle allopathic meds without proper training, we're gambling with public health, the IMA stated in their official complaint. The big question: should healthcare systems prioritize accessibility over specialization? When homeopathy practitioners gain modern prescribing rights, does that help underserved areas or compromise care quality? Now it's your turn to weigh in. Do you believe homeopathy practitioners should have expanded prescribing rights, or do tighter restrictions ensure safer healthcare? Share your thoughts below. 5. Doctors protest against Homeopath-Allopath controversy in Maharashtra. Private hospital doctors stage 24-hour protest over Homeopath-Allopath row. A growing number of doctors from private hospitals, clinics, and nursing homes across the city have joined a 24-hour protest against the Maharashtra Medical Council's, MMC, decision to register homeopathic practitioners who completed the certificate course in Modern Pharmacology, CCMP. This move has sparked widespread debate over the role of alternative therapies in mainstream medicine. As part of the protest, private healthcare facilities will close for 24 hours today. While outpatient departments, OPDs, will remain inaccessible, emergency, maternity, ICU, and ambulance services will continue as usual. The protest aims to draw attention to concerns about the integration of homeopathy into conventional medical practice. The Maharashtra Association of Resident Doctors, Central MARD, has officially endorsed the protest, pledging to organize a statewide agitation if the government fails to withdraw the notification. The association's leaders emphasize that the decision undermines the integrity of allopathic medicine, which has trained thousands of doctors over decades through rigorous, evidence-based education. Medical Dialogues recently reported that the Maharashtra Senior Resident Doctors Association, MSRDA, strongly opposed the MMC's decision, urging the council to revoke the notification immediately. The group argues that the move is medically indefensible, ethically unacceptable, and legally questionable, highlighting the deep divide between traditional and modern medical approaches. They contend that allowing homeopathic practitioners to practice allopathy risks eroding public trust in conventional medicine and potentially compromising patient care. This controversy has intensified as the public debates the merits of alternative therapies. Critics argue that such practices lack scientific validation, while proponents claim they offer complementary benefits. The protest underscores a broader tension in healthcare: how to balance innovation with established medical standards. As the debate continues, the question remains: should alternative medicine coexist with traditional practices, or does it pose a threat to the foundation of modern healthcare? The answer may shape the future of medical education and patient treatment.